Are you saying, oh no, we're not ready for hospice yet? Or are you saying, oh, hospice really means you have to die right now? Or are you saying, oh gosh, I think it's time for hospice? Hello, I am Joe Rosen, president of Parkinson's Resource Organization, and we're here again to tell you things to know right now. I love working with Dr. Howie Cohen. He is the medical director of family hospice care here in the desert. He is a soul and a soulful man, and I am so glad that he's here to talk to you about hospice today along with me. Thank you for being in the front lines, though. We're going to call you Howie today. It's otherwise I know Dr. Howard Cohen, MD. Tell us a little bit about you first.
Well, thank you, Joe. That was a very sweet introduction. And I really respect and honor everything you do every day. You have an amazing soul and spirit, so thank you.
Thank you.
Well, I been working in the hospice field for a little over 17 years. I started in the hospice field as an outreach from taking care of patients from the emergency department, because I was also board certified in emergency medicine and practiced that for 15 years. This is an overlap, so I'm not as old as it sounds. Maybe I look that old, but it was an outreach to take care of fragile elderly patients at home who were using 911 for their care. So it grew into a very large homebound fragile elderly program, which eventually I phased out of emergency medicine and started taking care of patients in nursing homes, assisted living facilities, boarding cares, private homes, since they couldn't get out of get to the doctor's office, and help save the 911 emergency system from non-emergency patients utilizing that service. And that led me into hospice, because many patients did end up requiring end-of-life care because they have terminal illnesses. And so I was boarded in emergency medicine. I became certified in hospice, as well as long-term care and geriatrics. So I have a lot of certifications. It looks good on my wall, which I finally put up.
But yeah, I mean, you can certify all around you, but your soul is still your soul.
Yeah.
With COVID-19, though, what's happening with hospice today? I know that you're extraordinarily busy, so I'm really grateful that you're taking the time today. But has COVID-19 really done different for hospice with you?
Well, it's interesting, because in hospice, what we do is take care of patients who have a short life expectancy, 6 months or less. As many of you may know, that's the criteria in the United States to receive the hospice benefit. In this strange times, we've all had to jump and evolve, because we have patients now that were healthy, had maybe some medical conditions such as heart disease, diabetes, other conditions, which made them a little more susceptible to the ravages of the virus, where other people have no symptoms. So it's been, as you've seen in the news, it's been evolving. A lot of information on the webs, the internet, which is in itself dangerous, because many of it is not true. However, the hospice community has been working with the healthcare providers at the hospital, the ICUs, to help teach them how to take care of patients at the end of life, to make them comfortable if they cannot be saved. As well as, it's interesting because many of our patients and their caregivers are out in the community, and some of them did develop COVID-19, and we had to be able to teach them how to isolate themselves from our patients, who are already very frail and susceptible to the virus, and not necessarily resolve.
Wow, so it truly is an overload of work, teaching, doing, and yeah.
Well, it's what we do every day. So I think the hospice community is a great asset for the healthcare community in general, the non-hospice community. The only other thing, though, that really makes it different and very challenging is we have to direct our field staff, the nurses, the caregivers, social workers, people who are going to go into the patient's home. we have to pre-screen the patients to know if we're at risk of contracting the virus from going into a patient's home. And at the same time, we're going to different people's homes. We have to make sure we're not bringing the disease into them. So there's a lot of screening both back and forth. We're checking fevers and symptoms every single day, every morning of all of our staff, and then screening our patients. We also have to, we're also wearing masks, gloves, and even strict full gowning for patients that maybe have been exposed, or caregivers that might have been exposed. So that's the biggest challenge, I think, for us.
You know, it's interesting and nice that you're saying in the patient's home. So I think many people think that hospice is a place that you have to go. There's so many things that people don't know about hospice. Probably the first one is that if you accept hospice, that you have to die, that the person who goes on hospice has to die. Why don't we start with that one? Because you and I have talked about this over and over. It doesn't mean you have to die. As a matter of fact, you can actually get better. So tell us a little bit.
Yeah, that's actually true. It's a great question. It's always good to repeat it because a lot of people, when they hear hospice, they think they're going to some place where they're going to be put in a hospital bed to die. Hospice in the United States takes place where you live. It's not in a hospital, although some patients may be in a nursing home that receive hospice, a board and care facility, but most patients want to be in their own home, and we try to assist them getting into their home and having they can hire caregivers, or they have family to come in to help them. But if they can't, there are facilities, nursing homes, as well as board and cares and assisted living facilities at different financial levels to hopefully have people care for them and not overwhelm the family, or if there is no family, and people can get care. And the hospice team goes in as often as necessary, nighttime, daytime, 3 times a week, every day, to take care of the individual and teach the caregivers how to medicate them if they need it. But the most important thing is, like as your question is, they don't have to die. A lot of patients come into hospice with non-cancer diagnoses, such as heart disease or dementia, and maybe they came on because they were dying because they had a urinary tract infection, and it cleared and they got better. So we get to graduate them off hospice, and we say discharge for extended prognosis. And a lot of times, I've said this before, I say this a lot, but it is true, and I think it's wonderful to hear, in a way, is that people come on to hospice kicking and screaming, I don't want hospice, because they have this vision that they'll lay in the bed and die. But then they're on service for a few months, and we realize they're not dying anymore, and they're going to live more than 6 months. And so we say, congratulations, you get to go off hospice. And then they scream and cry, I don't want to go off hospice. I like the care, I like the service. And they actually appeal the discharge, and they have that right to appeal. It goes before a separate group per Medicare called the QIO, and they make a decision to say, you know what, Dr. Cohen is wrong. You get to stay in hospice, but you are going to die. Or they say, no, we agree that you're not going to die. Congratulations, but you don't need hospice anymore. So it's very interesting. It's very interesting.
It is.
I think it's because we have such wonderful people, that the nurses, the caregivers, the home health aides, these dedicated people that work in the field for years are amazing.
The hospice people, every one of them that I have ever met, and in my family, I happen to have a sister-in-law who is a hospice worker. So I just think what she does is so extraordinarily wonderful. But the other thing that happens with hospice is that there is a doctor on board with somebody. So you can actually, if you are on hospice, you could actually give up your other doctors so you don't have to trek. In Parkinson's, that's so hard to sometimes get a person in and out of the house or wherever to go to the doctor. Because there is a doctor involved in hospice, they don't have to go to their other doctors, do they?
No, that's true. And that's one of the reasons that people and families like it, because we don't just take care of the Parkinson's disease, but if they have diabetes and they need medications, or they need either the change in their blood sugars or the thyroid disease, they need to refill their medications, we'll do that for them. We'll absolutely do that for them. And we will also do home visits if necessary, if they request. We try to see, hospice, the Medicare hospice benefit, which guides the way we we treat hospice patients in the country never requires, this is shocking me, but Medicare never requires a hospice physician visit. It's typically a nurse-driven program. However, I was taught in the last 17 years, originally trained, that it's really important for the hospice physician, if they choose the hospice doctor to be their doctor, because they can have their own doctor take care of them. It doesn't have to be the hospice doctor. But most of the time they do choose us because the hospice, the primary doctors really can't do home calls, house calls.
Yeah.
But so what we will do is we try to see the patient as soon as possible within the first week of admission, so the family and the patient knows who the doctor is that's taking care of them. And I think it's really important.
I love that idea. So when should somebody start thinking about hospice? If they're going through a journey like Parkinson's or any chronic illness, is there a point where someone might think, oh, I should start considering hospice?
Probably when you know, I think most people know when they're declining, when their disease is progressing, and they've tried a lot of options and they're not working. I think most people know, and I think that's a time to talk about it. And they could also, hopefully feel comfortable discussing with their primary doctor and just ask, do you think I need hospice? And unfortunately, many physicians don't understand the hospice criteria.
Yeah.
But I always talk to physicians. I give lectures to physicians. I teach family medicine residents. I say, if you ever have a question about whether a patient meets criteria, if a patient's asking you about hospice, call me or call one of my other providers. We have a wonderful doctor, Dr. Suzanne Johnson, my colleague. Call us and we'll be happy to run it by you. Or order the hospice evaluation. Our hospice trained nurses that do it all admissions can meet the patient, go over the patient's condition, look at the records and then call the physician and said, does this patient meet criteria? There's no cost, and at least it gives you an idea whether it's appropriate or not.
Yeah, and actually, I've said this over and over and over. It's Medicare's best kept secret. Most people have no idea that it's covered by Medicare. They don't know where they can go, not go. But it truly is Medicare's best kept secret. And sometimes when someone is really going down the journey of an end zone, if you will, I will talk to them about getting hospice on board for the benefit of everybody that's involved in that little community. The caregiver, the person with the disease, get some relief. It's almost a respite, and it's like a relief that we have these medical people around. Are there books about hospice? And more than books about hospice, I think what I'm asking, Howie, is are there books about death and dying that someone might look at? Because I'm going to ask you another question in a minute, I think, unless you cover it with this answer, about death and dying. What can you add? What can you tell somebody about that?
Well, there's a lot of great literature out there, and I knew you were going to ask me this question. So I pulled some books that I have in my library here at home, and I'll just show you. They're not in any special order, although some of you may have heard them. But this is a wonderful book by Atul Gawande. It's called Being Mortal.
Oh, I love that book. Thank you.
Yeah,
yes.
He's amazing. He is amazing. And then, oops, what happened?
I still have you.
Can you see me?
Yes, I can.
Oh, okay. So I see nothing, but
okay.
I will. I'm not going to change it to touch anything. Just lose you. Another book by Sherwin Newland. Have you heard about How We Die? It's reflection on life's final chapter. Amazing book. And these are all really wonderful books and easy to read, I think. Barbara Combs Lee wrote Finish Strong. Another amazing book. She works for a company, agency called, or a national group called Compassion Choices. And she says on the back, it's hard to talk about death in America, but even though the topic has been taboo, life's end is an eventual reality. So why not shape it to our values? And so that's a good one to read as well. Ira Byrok, Dr. Byrok, I'm sure you've heard of him. The Four Things That Matter Most. This is one of the first books I read. And then also another one, Dr. Pantalat, Life After the Diagnosis. And this is a really revealing book, and helps give a lot of introspect to the individual reading the book about their disease process and how they want to live and die. So
those are so good. Thank you for all of that. And the other thing, I think, who's the woman that wrote of Death and Dying?
Elizabeth Kubler-Ross.
Yes. So, one of the things that helped me when both my mother and my husband were leaving the earth, if you will, was understanding some of what goes on innately, because it does. If you're close enough to the person who's dying, you have an understanding that the universe is doing certain things, like bringing the children in or bringing the grandchildren in or whatever. That's all happens, it seems, innately to me. But understanding what happens as someone is actually experiencing death it gave me so much solace to understand what was going on, that I think in her books, we really get that kind of information. I highly suggest to anybody that in full life even understand the process of dying. Makes it so much less scary and so much more real, and I was going to say inviting, but I don't think I want to use that. But it just makes it so much more understandable, and that death is really an extension, if you will, of life. I think that's how we say it. So what you and I have always talked about, hospice isn't about dying. It's about living the very best that you can until there is no life.
Right.
So having said that, is there anything specific you'd like to add today before I go into the little closure part?
No, I liked what you summarized, because this is our philosophy in at least in our hospice, and the hospices I've worked with in Orange County, and now here at Family Hospice Care. Hospice is about living, not dying, and we try to promote the best life possible for now, living in the moment. Yes. You can go to the movies today, go today. Don't wait till the weekend, because you may not feel well enough to go. And, it helps, I think even about COVID-19 is we worry about the future. Oh my gosh, what if this happened? All it does is create more anxiety, more depression, when we don't know what's going to happen. Except we do know that we will get through this and it will end. But when it ends, we don't know. So let's just try taking a day at a time, like we do in hospice, is just enjoy today, enjoy your family, talk to your family, tell them what you want, how you want to live, how you want to, if you want to talk about the future, talk about how your dying process will look like. And that's what we do in hospice. We help set that up so you do have the proper.
And that is such a gift to give to the living. I will tell you that when someone actually understands how and talks about how they want to leave, it is such a huge gift to those left behind. I just love this part of what we do here at Parkinson's Resource Organization, because we take people from diagnosis through death, if you will, and I love all aspects of what we do, but I really like discussing the end part of it, when it's uplifting and it's spiritually fulfilling. So
it should be a beautiful experience. I mean, it's always sad to lose someone to passing from any disease process such as Parkinson's, but what I always tell my patients, and I tell my staff, my colleagues I work with, I say, I try to minimize regret. Said, if that way, because when some of my nurses may say, well, the individual wants that chocolate cake and they have diabetes, and the wife won't give it because he has diabetes and it might affect his heart and things, about his blood sugars. And I say, you know what? I'll ask the wife 10 years from now, would you regret giving your loved one that piece of chocolate cake? And if they usually say, yeah, well, they give the chocolate cake. We can help you with the diabetes. We can give you some more insulin or treat the blood sugars. But you know what? 10 years from now, you'll regret not giving the chocolate cake.
Yeah.
So let's help you prevent that regret and really enjoy that moment. Instead of saying, I wish I gave the chocolate cake, I said, boy, you should see the smile on my husband's face when he got that slice of chocolate cake. And that's what I want to try to minimize regrets and really promote living.
And create better memories.
Absolutely.
Okay, so for the audience, I just need to tell all of you, watch for the articles in the newsletter. Dr. Cohen and his staff are very wonderful to submit articles, and they're all helpful to all of you. As you know, this is Parkinson's Awareness Month, April, if we happen to be recording this. And we've launched something else, and Dr. Cohen will be one of our speakers in it as well. We have the village meetings, which used to be called our speaker meetings when we had physical support groups. Now we're bringing them out virtually to everybody. So when you see on the calendar virtual village meetings, know that they are going to be speaker meetings. We have our round table meetings, and we have our caregiver only meetings, and you'll start seeing the calendar on the website populated by this. You also can find Dr. Cohen and many other resources like him in the Wellness Village, which is on our website, and it is a virtual, vetted, video-driven resource directory to find magnificent and wonderful people like Dr. Howard Cohen. I cannot thank you enough for being with us today. I so appreciate you being in my life, and certainly in the lives of those that we work with and for. Thank you so
Ditto.
much.
Thank you, Joe, and I appreciate everything you're doing for the community and Parkinson's. And I'm just honored to be a part of it. Thank you so much.